Good evening. Welcome to our lecture on maintaining your emotional health during COVID-19. Before we begin, I need to make a few announcements. At a time when we're all asked to limit our trips outside our homes, a visit to the doctor may seem out of the question. But if you have a new or ongoing health condition or develop a medical emergency, it's critical to get treatment right away, even during this pandemic. Boulder Community Health's staff and facilities are prepared to treat a comprehensive range of medical issues while keeping patients protected from the COVID-19 virus. Doctor visits are available both in person and through virtual visits. And emergency responders and emergency department staff know how to keep you safe from the threat of COVID-19. Now I'd like to go over the format for this lecture. The lecture portion will last about 45 minutes. Afterwards, we'll use the remaining time for questions. Please type your short question into the chat box to the right or below the video on your screen, and we'll do our best to get to it if time allows. On behalf of Boulder Community Health, I'd like to introduce our speaker, Martha Hawkinson. Martha Hawkinson is the lead case manager with Mental Health Partners, where she works closely with survivors of trauma in virtually every aspect of their process, from health healing process, from assisting with therapeutic resources to financial assistance to addressing family resources. An expert in psychoeducation on trauma, she takes a strength-based approach to helping clients build and utilize their toolkit of coping and resilience skills. During the COVID-19 pandemic, she has also been working with community organizations to coach frontline and leadership staff on issues such as anxiety, traumatic stress, and self-care, and assisting them in recognizing barriers to success for their clients. Thank you. Welcome, Martha Hawkinson.
Thank you, Derek, for that wonderful introduction. Again, my name is Martha Hawkinson. I have been with Mental Health Partners for about 4.5 years, and I'm so excited to be able to share this lecture with you and for you to join us. I want to start with a bit of a reflection, knowing that the content of this lecture can be potentially anxiety-provoking and stress-producing. I want you to put yourself first during this next hour. If there is any point where you feel like the content is too overwhelming or too anxiety-producing for you in the moment, I invite you to take out your earbuds or to turn off the webinar completely. And I can tell you that this webinar will be recorded, so as you feel capable and willing and interested in doing so, you can return to this webinar when you feel prepared and want to get further resources. Again, thank you so much for joining us. So I want to start with some statistics, just so we can basically take a pulse on where we are mental health-wise across the country. So the Kaiser Family Foundation put out a poll in April that was collecting a bunch of data on the impact of the pandemic thus far, looking at the mental health of those in the United States and how this pandemic has impacted that. In that recent poll, one of the most important statistics that I found is that nearly half, specifically 45% of adults in the United States, have reported that their mental health has been negatively impacted by stress and anxiety of this pandemic. This particular graph is merely a reflection of those statistics, diving into a little bit more detail of the different elements of stressors that we're experiencing because of this pandemic. Some other graphs in this Kaiser poll include the impact of job loss, changes or reductions in income, the status of our physical health, in relation to the way that the pandemic has impacted us. So if you want to do a deeper dive into that data, I have the link later on in this lecture so that you can look deeper into the statistics of the impact that we have seen that the pandemic has had so far on our mental health. Looking at this particular graph, you see that there have been a large amount of both major and minor negative impacts on a couple different populations, those that have both sheltered in place and not sheltered in place during this pandemic. What I want you to come away with from this graph is that stakes are high as it pertains to the mental health of people in the United States. Because stakes are high, we need proactive, impactful, and implementable ways to combat these statistics. We all have in our daily lives before this pandemic varying levels and types of stress. Because of this pandemic, our stress can feel quite cumulative and very much adding and stacking on top of each other. So I want to look at some of the different elements that layered stress contains. First, our personal stress. And that is fed by feeling disconnected and isolated, which has been caused in part by the shelter in place or the safer at home orders that have been implemented where you live. And at the same time, those shelter in place and safer at home orders are also keeping us physically safer. This is the beginning of this continuum of types of stress. After personal stress, there is financial stress that can be fed by loss of a job or reduction in hours, potentially a reduction in income. This is something that is happening both personally on an individual level, and we also see the impact of this on an large economic scale. Familial stress is fed by having to balance learning how to work at home if you didn't do so before, trying to also balance taking care of your children if you have children at the same time, and also wanting to keep up with the education of those children that are now staying at home with you, probably 100% of the time. Along with those familial stresses, of course, there are the other to-dos that happen in your household: cooking and cleaning, laundry and dishes, and paying bills. Cultural stress zooms our scope out a little bit, and it looks at our community. Cultural stress is fed by worry about our communities changing. What will happen to the restaurant that I bring my family to once a month or once a week? Will I be able to return to the gym, the yoga studio or climbing gym that I went to? Will I be safe there? And will they be able to bounce back from the financial and personnel hardships that have come with this pandemic? And finally, cumulative stress. And cumulative stress is all of these prior stressors, so personal, financial, familial, and cultural stress. And then on top of that is our experience of taking in media. It's important to be able to find a balance, especially looking at cumulative stress, being able to find a balance between taking in news that is helpful for you to make decisions and not over-consuming out of curiosity, which can greatly add to our levels of stress and anxiety. You see along this continuum that we have built up stress that can range from minor inconveniences, like potentially having to figure out how to work from home when you have worked in an office before, disruptions in our routine and such, all the way to fearing for the health and safety and livelihood of both ourselves and the people that we love. This can make the time of living through a pandemic potentially a traumatic experience or a traumatic event. And very simply, a traumatic event is something that is deeply distressing or disturbing. And if you carry a perceived or real threat that this pandemic has over our own personal safety and health and lives, it very much can be considered a traumatic event or experience. For those that have felt a true sense of, or perceived sense of, threat to our livelihood, this can be a traumatic event. And with a traumatic event comes very common responses. You can see some of these on your screen on the PowerPoint. Some of the very common responses that people have both during and after an experience that is highly stressful and potentially traumatic. Anxiety and hypervigilance, that has definitely substantially increased in this pandemic. Worry about, can I keep my family safe? Can I keep myself healthy? Irritability, when we experience change, I think it's very common that people experience irritability, trying to figure out how to adjust to a new normal. As any level of stress increases, there are very often changes in sleeping and eating patterns. And this could go from one end of the pendulum to the other. It could go from not sleeping hardly at all, not having an appetite, all the way to sleeping a lot as a coping mechanism, and eating more than we usually do also as a coping mechanism. Forgetfulness and feeling out of sorts comes very much with the territory of our brain being in trauma response and our levels of anxiety and stress being substantially higher than usual. There is also a sense of sadness that can come along with traumatic experiences. Sometimes you can directly place that. I'm sad that there are so many people sick, that people are losing their jobs. It can also be a general sadness or a basic reduction in our level of happiness or satisfaction. The key to these is to recognize that they are common trauma responses. It is so frequent to experience these responses or these symptoms while, during, or after a traumatic experience. Having these happen in your life right now does not mean that you lack coping skills or that you lack resilience. Instead, I want this to be an opportunity to reflect on the ability to utilize your resilience and hone your skills of coping and resilience while in this pandemic. So I'm going to go through first some concepts around resilience and then look at some coping mechanisms and skills. I'd like to weave in a brief reflection in there as well. So resilience, very simply, is the ability for someone to withstand and rebound from adversity. We often think of resilience as an individual characteristic or trait that we hold. And that is partly true. However, it's not complete. Resilience is both individual and relational. And both of these types of resilience are especially important in this experience of the pandemic because this pandemic is not only an individual experience. It is community-wide, it is national, it is international, global. So individual resilience is what we have simply within ourselves, our own level of reservoirs of resilience and coping skills. Relational resilience is the strength that we have from prior relationships that we had before the pandemic, relationships that we have during this pandemic, and new ones that we are cultivating through this pandemic. Because this is such a collective experience, although people experience it differently, it is important to look at both of these types of resilience. So I want to do a brief reflection, and before I do that, I am going to give you an example so that you can see basically how to do this reflection. So the reflection question is, in past times of stress or trauma, how did I cope? So I'll give you an example. When I was about 17, I was driving in a car as the passenger with one of my close friends, and we were T-boned on my side. So a car struck the passenger side of the car that I was in, and both myself and my friend had to figure out how to respond, both in our instinctual ways and also in our processing and problem-solving mind. So for me, what I first did, I checked over my body, looked at my limbs and checked my head and made sure that I was physically okay. I took a deep breath and my mind immediately went to, what are the to-dos in this situation? We need to find a place to safely get off the road. We need to collect the contact information of the other driver, their insurance information, and assess the damage to the car. My mind immediately went into, how do I problem solve this? My friend had a very different experience. She, like me, checked over her body to make sure that she was physically okay. She very immediately started hyperventilating and wanted to flee the experience. She assumed that her car was fine. She didn't want to talk to the other driver. She wanted to escape the experience because of the high level of stress and anxiety that this traumatic experience caused. She had a very emotion-focused response to the situation at hand. Those are two different responses to almost the exact situation, the only difference really being the location of each person in the car. I was in the passenger seat and she was in the driver's seat. We had very different responses, and the way that we coped in response to that stress and trauma was very different. So I want to give you just a couple seconds to think about, how have you coped in the past? Don't think about, I coped well or I coped poorly. Think about the actual skills or things that you did in that circumstance in response to the trauma and stress. I'm just going to give you a few seconds. So the first thing I want to tell you after that reflection is that your coping skills in response to that experience of stress and trauma was the best that you could do in that moment. We utilize very specific coping skills to make sure that we keep ourselves and the people around us safe. And it's easy to look back and say, I didn't do that well, I should have done something different, I need to do this different in the future. And the coping skills that you used in that moment were what were able to keep you alive, mentally, physically, and emotionally safe. The focus in that moment is surviving, right? Because this pandemic is a long-term experience, it's important to find ways that we are not just surviving, but that we can be individually and collectively thriving in this experience. So if you look at this slide, you can see the different ways in which the example that I showed you, myself and my friend, differed in our responses. She had emotion-focused coping skills, and her coping skill in that moment was fleeing the situation and regulating herself in a place that felt safer. I was very problem-focused, and my coping skills were to tick off my to-do list. There are very often these two common camps, and most people at one time or another fall into both of these, and at the same time often find ourselves more in one of these camps than the other. In both emotion-focused coping skills and problem-focused coping skills, the desire is born out of a loss and a want to regain control. Problem-focused coping skills are exceptionally useful when a situation needs to and can easily change. Emotion-focused coping skills are slightly different in that they are exceptionally helpful when a situation cannot clearly change. In this pandemic, there are small parts of the experience that can change, and many that we don't necessarily have control over. And so looking at this infographic, we can assess the things that we do have control over. I'm going to walk you through these continuums, and I would invite you to come back to this as an activity for yourself after this webinar. So you look at the first one. How are you caring for yourself and others? Are you balanced in the middle? Are you not looking after yourself, or are you overindulging? That can be in relation to food or connection or physical activity. The next is work. How are you balancing your work? Do you feel like you are working much more than you were pre-pandemic? And is that having an impact on your daily life when you are not working? What level of activity are you engaging in? How are you moving your body? And are you allowing yourself to rest? And a balance of connection is also hugely important. Are you finding ways to be able to connect with your values, with the people that are important to you? And are you also allowing yourself a time to completely disconnect from potential media consumption, connection to people that might cause stress? How are you balancing those? So again, I would invite you to come back and look at this and assess where you are on these continuums. Look first at where you are currently, and give time to also look at where you want to and where you need to be for your well-being. So I mentioned a bit about control during this time in the pandemic. And there is a concept called locus of control. People have different locuses of control based on their personality and their traits, some of their personal characteristics. For some people, they have an external locus of control. And that basically means that it feels as if things are happening to me, that I do not have exact control over what is happening to me. And an internal locus of control is basically the opposite of that. The belief that I have control over what is happening to me. In times of uncertainty, it can certainly enhance the feeling of an external locus of control. And that can feel really disempowering. What's important to focus on and empowering to focus on is what we are able to control and honing what we are able to control and how. So I want to share with you some coping practices, and the reason that I want to share with you practices that you can incorporate into your life on a daily or a weekly or whenever feels right basis for you is this is a way to regain some of the control and internalize more deeply our locus of control in a time where things can feel like they're potentially happening to us and we don't have a lot of decision-making power. We have a lot of decision-making power in what we are able to do and the way that we do things on a daily basis. The first is a gratitude practice. I have found and heard from many people that a gratitude practice is something really good to do in the morning. And it can basically be a way to frame your day. Starting your day out with some reflection of thankfulness can set a good mood for the rest of your day. There are tons of different resources for a gratitude practice. There are journals and notebooks that are specific for a gratitude practice. I don't use any of those. I just use a notebook, sometimes use my computer, and follow the same pattern each day. I am going to share with you one of many, many gratitude practices. And as I go through, let me step back for a minute. As I go through these daily coping practices, I invite you to take what feels helpful and resonates with you and let the rest of it fall by the wayside. Again, you can return to this webinar whenever you need and can look at some other practices that maybe didn't resonate with you the first time you heard it, that might resonate with you a week or a month or 3 months from now. So back to the gratitude practice. One particular practice that a lot of people do and I utilize personally is sitting down in the morning and listing a place that is safe and relaxing to me. It could be a physical place, it could be a place that you've been to, that you want to go to, or a place that doesn't exist. A thing that is going well in your life. This can be small, it can be big, something that's going well. 3 things that you enjoy, people around you or things that you do, and then 2 people who you love and who love you. This again allows you, if done in the morning, to create a trajectory through your day where you can be more aware of the small good things that are happening in our lives. Routine and productivity is probably one of the biggest upsets that has happened individually during this pandemic. We had a routine that maybe worked really well for us before this pandemic, and likely it has changed in at least one way. If you haven't been able to yet, I encourage you to set a routine and stick to it as much as you can, allowing yourself flexibility in that, really based on what comes up throughout the day, other to-dos or emotional responses that you have. Productivity has likely also changed. Maybe it has gone up, maybe it has gone down. For myself, it fluctuates day to day. If you are very focused on continuing at the level of productivity that you were at before the pandemic, doing something like listening to ambient music or white noise can allow your brain to really hone in on the work that you're doing. At the same time, brain fog is so normal during this pandemic. It is another very common response to high levels of stress and anxiety. A decrease in productivity is also something that has been seen across the boards. Breaks and downtime. We have, again, a sense of how productive we want to be, should be, are expected to be. Breaks are a way of, it might be counterintuitive, but to be more productive. There are a couple different types of breaks. First and foremost is an active break, where you are still very much stimulating your brain, keeping your brain very much online, but pivoting away from the activity that you were doing before. One way of doing this is switching from a project that you're working on to filling out or beginning a New York Times crossword. And maybe you don't finish it in the break time, but you can come back to that throughout the day or throughout the week. Inactive breaks are also very important. And one way to really make the most of an inactive break is to do some sort of breathing practice. There are probably thousands of different breathing practices that you can find based on what you're needing, whether it is to reduce stress, to increase focus, to calm your nerves. Breathing practices can be a very productive way of using a break that you have. Something that I have been doing with colleagues is taking a virtual coffee break. That at work in our physical office was a way of connecting both around our personal lives and around what's happening at work. That is still very much something that you can do. It looks different. You're looking at the person on a screen instead of face to face. But that is a way to also increase connection to the people who you probably saw on a regular basis before this pandemic. Movement. It can certainly be hard in times of high stress and anxiety to be motivated to move. And I'm sure that you've heard it before, it is so important. An experience of brief physical exertion, which could be a short yoga series, it could be a brisk walk, increases our heart rate and potentially also increases the rate of our breathing. So we're breathing more deeply into our lungs. That means that we're getting more oxygen to our brain at the time of that exertion. It's been found that more energy to our brains during and after this physical exertion can improve both our immune responses and our emotional stress levels. So I mentioned one way of doing that is a yoga practice. I'm going to share with you a little bit later an opportunity to be doing virtual trauma-informed yoga as a way of utilizing and incorporating movement into your daily life. Trauma-informed yoga is a special type of yoga that takes into account the fact that we have or currently are experiencing trauma and engaging our body in movement that feels safe and also keeps us in our bodies at the same time. And finally, connection. Certainly, while it's hard to see people face-to-face, or if you are seeing people face-to-face, keeping a physical distance can potentially make us feel more disconnected than before this pandemic. There are a couple of ways that I have heard from many people have been helpful. And it's weaving together virtual connection and things that before the pandemic you really enjoyed doing. For example, cooking. If you love cooking, one idea would be to send a recipe to a friend who also enjoys cooking, who maybe you would cook together before the pandemic, and you make the same recipe, and you share a meal virtually. In that way, you're able to have a very common and shared experience while not face-to-face, but still creating the connection over something that you have shared and loved together previous to the pandemic. Another idea, if it's not cooking, is game playing. So groups of friends that played Yahtzee in person before the pandemic. A way of doing that now is to have pulled up on your computer both an online Yahtzee game and also a Zoom call. So you can be playing with your friends or your family a game that you have loved sharing with each other, and also be having the conversations that you usually would be having if you were physically around a table together. Again, I invite you to look at these daily coping practices. Take what feels resonant to you and leave the rest. At this time, it is so important for us to have grace and patience and compassion for ourselves and also for the people around us. We are all at different levels of coping and resilience and well-being during this pandemic. And so incorporating patience and empathy in your interactions with yourself and your interactions with others can make a big impact in your emotional and mental well-being. I want to share with you some resources that once you receive a copy of the PowerPoints, you can be utilizing these resources for yourself. The first is an app that you can download onto a smartphone that is it's a basic coaching app that is specially focused on our experience of the COVID pandemic. So I shared with you some coping skills, some ways to build resilience, and of course there are many more. This COVID Coach app gives you the opportunity to engage with other resources and coping skills to increase your well-being during this time. I also shared with you one gratitude practice. There are so many others, so if you want to try a gratitude practice, but the one that I shared didn't really resonate, you can look at some other gratitude practices on this link. I mentioned also virtual trauma-informed yoga as a way to get our heart rate up and to get our breathing more deeply into our lungs, increasing oxygen, like I said, and a boost in our immunity and also our emotional well-being. Virtual trauma-informed yoga is a weekly offering that two programs of mental health partners called Moving Beyond Trauma and Moving to End Sexual Assault offer on a weekly basis. And then a tiny guide. And tiny guides were originally created for breaking down complex ideas like anxiety and stress to a level that children can resonate with and can understand. For me, as an adult, these also very much resonate. So there are a multitude of tiny guides on many different topics that Cultures of Dignity has put out that could be helpful both for you and if there are children in your life that are struggling to cope as well, could be a shared resource for an entire family. I mentioned two programs of mental health partners. Moving Beyond Trauma, first and foremost, is a clinical team of trauma specialists that do one-on-one and family therapy for survivors of all different types of trauma. And if this time during the pandemic feels like a traumatic experience for you, you are not alone, and there is support in both professional and non-professional ways to increase your well-being. Moving Beyond Trauma can be one of those professional resources. Moving to End Sexual Assault works specifically with survivors of sexual violence, knowing that those that have experienced all different types of trauma or violence can find this pandemic to be especially hard and potentially triggering. This community resource list is an opportunity to engage in immediate needs services that are offered, in this case, specifically throughout Boulder County. So support for housing, support for food. As we know, resources and our own reservoirs have changed and potentially decreased as a direct result of this pandemic. There are resources for those immediate needs to help you meet those for yourself and your family. If you're interested, again, in professional support, in processing what's currently happening and engaging in a way to increase or boost your mental health Partners intake line is there. And if you are experiencing, or someone in your life that you care about is experiencing a crisis, whether it is related to this pandemic or not, the Colorado Crisis Line is there. You can call or text, and it is confidential. I want to thank you all so much for joining this lecture. We will now switch over to the questions portion, and I thank you all again so much for joining us. Looking forward to hearing your questions.
Thank you so much, Martha, for that lecture. We're just going to give the viewers a moment to catch up, and then we will have some questions for you. All right, Martha. Now that I'm working from home, I'm finding myself working much longer hours, not separating work life and personal life ideas.
That's a great question. I think that is one of the really hard boundaries to set, especially when we don't live alone, whether it is with a partner or friends or with children. There are a couple of ways to create and establish and reinforce some boundaries around the work that you do. Firstly, if there were regular hours that you worked pre-pandemic, whether it was 9 to 5, 7 to 3, see if it is possible to stick to those. And a way of working to stick to those, if possible, is to have a reminder or an alarm on your phone or on your computer that basically dings and reminds you that it is the end of the day. That is one way of holding yourself accountable for ending your day at a reasonable hour. It's so common for when we are working at home to really blur the lines between working and not working. If it is possible with the people that you live with, ask them to help you set some of those boundaries. So if there is a certain period of time that you know usually you're super productive, maybe it's in the morning right when you start, 8:30 to 10:30. Ask the people that you live with to only interrupt if it's an emergency, and you can create basically a tree of first do this, then do that. If that doesn't work, come talk to me. Setting some boundaries around the way that people and how frequently people engage with you can also be very helpful.
All right, the next question. I wonder if you have any suggestions for someone like me who has bipolar. I'm in stasis right now, but I never know.
Can you repeat that last portion?
He says he's in stasis right now, but he never knows.
I see. Something that can be really, really helpful and certainly has probably changed since the beginning of the pandemic. We can identify certain things that can be either a trigger for us or some kind of signs that we track that could go into, as we see ourselves kind of curving into mania, if that's an experience that he has. Those might have changed because so many of our experiences in the pandemic have changed. So I would encourage to kind of track what are some of the maybe new patterns or new feelings that come up that you can see as a pattern of expanding into an experience of mania. It's because it's a totally new experience, it absolutely takes some time to be able to track some of those patterns. It's not necessarily a quick fix.
Being around grandchildren has been a major source of my daily joy and routine. How do I make up for that loss currently?
That is a great question. There are a couple of ways that come to mind, and I first want to recognize that there is no replacement for being in person with people that we love. And something is better than nothing, right? So if there were games that you played together, there are so many games online that are built for young children all the way up through adulthood. If there were games that you like to play, try and find a forum for it online. Chances are you can find like a checkers games, like I said, Yahtzee, simple games that you maybe enjoyed with grandchildren. And I think it would also be totally okay and appropriate to ask if they would draw you something. Maybe they would give you drawings and you would put them on your fridge and you only have ones pre-pandemic right now. Ask if they'll draw you something. Maybe they do it on their iPad, maybe they do it on real paper and send it to you via snail mail. But a way to connect, again, with the things that brought you together before, although it's in a new way, and maybe a more challenging way, is still a way to connect and really foster the relationships that, of course, you value very deeply.
Can you give some help on how to respond to people thinking I'm overreacting, not going anywhere? I have an autoimmune issues and asthma. Feeling left out and others are upset, I won't visit.
That is totally fair. I think that has been a challenge for all different communities, whether it's families and roommates, figuring out how do we respond to these orders? How do we interpret a stay-at-home order or a safer-at-home order? I would encourage you, and there's a chance that you have tried this already, to see if the people that you're wanting to connect with would be willing to do so virtually. It might be harder for them, and I would hope that there would be an understanding that with a compromised immune system, stakes are higher for you. And maybe that means right now connecting with fewer people, connecting with the people who really get it and are honoring of your level of safety needs, and maybe reconnecting with the people who are not willing to be necessarily as flexible with virtual connection as you would hope that they are. And I want to recognize that that can be really disappointing, to have people that are close to you also not be understanding of the experience that you're having and the worry and stress that you're having for your own physical safety. For that, I'm sorry that you're experiencing that.
I struggle with my husband and I managing our trauma coping in such completely different ways. We always seem in conflict, even with little things. Any advice on how to find common ground?
That is such a common experience. We have each of our certain ways of responding to stress. And certainly this time can bring up some of those coping skills or ways of interacting that can totally be in conflict with each other. What I would invite you to do is, in a time where you're not disagreeing, see if you can take that moment or couple of moments to figure out collaboratively how to respond in ways that support each other when you are in conflict. It's so hard to do and often not super productive to do in the actual conflict, but when tensions are lower and when people feel more at ease, that can be a great time to sit down with someone and say, okay, I know that when you say this sort of thing in particular, this is my response. This is why I'm responding that way. How can I communicate with you in that moment, because I know we'll get to it again, in that moment to diffuse that high anxiety or stress. And that is so often trial and error, trying to figure out how to communicate with each other and use the right words to not cause the other person to feel hurt or shamed or guilty. It really is it's a trial and error process that requires a lot of grace for yourself and forgiveness of yourself, and that same thing for the other person.
Martha, I'm just going to give our viewers a second to gather their thoughts and get some more questions come in. We have a few more minutes left in the question and answer, and so I'm just going to give a moment.
Wonderful, thank you.
All right, Martha. I have not been able to sleep much at all over these last few months. My mind races. Do you have any suggestions?
Sure. So the first thing that comes to mind is a different type of gratitude practice. And so the idea is a spin off of counting sheep, which I have found very, very rarely works. Instead, counting moments of gratitude. So counting things that you are thankful for. That could be things that happened throughout your day, people in your life. Counting things that bring you a sense of calm, a sense of centeredness, and a sense of being loved and cared for can be really helpful. And we briefly talked about media consumption. And there is certainly a need for balance in media consumption, especially of pandemic-related issues or topics. And if you want to be consuming those during the day and feel like you need to be doing that, absolutely do that. What would be helpful would be to not be scrolling through, whether it's your phone or your iPad, immediately before you're going to bed. And that can be true of any sort of screen use, but especially when the content is highly stressful and it can increase your level of anxiety and stress. It's something to not engage in definitely the hour and potentially 2 hours before you go to bed. That is a way to really calm your mind, at least as it pertains to media related to the pandemic.
We've come to the end of our time. Thank you for joining us. A recording of tonight's lecture will be available at bch.org/livestream in about a week. You will receive a post-lecture survey by email tomorrow. Please take a minute to fill this out. Thanks again and have a wonderful night. Thank you, Martha.
Thank you, Derek.